Welcome to the Lifestyle Medicine Update. I'm Dr. James Meschino. I want to talk to you about some research related to long COVID syndrome. So long COVID syndrome affects 50 to 70% of all COVID-19 survivors. But doctors have been at a loss to predict who's susceptible to developing long COVID. Now, the study published in the April 2023 issue of the Journal of Clinical Endocrinology and Metabolism suggests very strongly that low vitamin D levels in the blood may be a very important risk factor for the development of long COVID syndrome. But this is what we've learned so far along the way as we've examined this. Up to this point, some evidence has suggested that just simply being a woman, as well as having diabetes, pulmonary disease, or being obese, may increase the risk of developing long COVID syndrome. Now, the symptoms of long COVID can involve neurocognitive issues like brain fog, as well as disturbances of the cardiorespiratory and gastrointestinal systems, constitutional symptoms, and musculoskeletal involvement like muscle pain and myalgia, as well as taste and smell disorders. Some people lose their sense of taste and smell, or things just taste very bad. Previous studies have shown that low vitamin D levels were associated with worse outcomes for patients who contracted COVID-19 infection. So lower vitamin D levels were associated in many studies with higher rates of death from COVID-19, more severe infections, increased likelihood of being admitted to the intensive care unit at a hospital, longer stays in the intensive care unit, an increased likelihood of requiring mechanical ventilation. A lot of studies showed this. In the early days of COVID, low vitamin D levels were related to much worse outcomes for people. So in April of 2023, researchers published a groundbreaking study showing that those with long COVID syndrome also tend to have lower vitamin D levels that in their blood than COVID-19 survivors who do not develop long COVID syndrome. So the study involved 50 patients with long COVID and 50 patients who contracted COVID-19, but they didn't develop long COVID. Now, the average age of the patients in the study were 61 years of age. That's sort of an equal mix of men and women. Now, after controlling for a host of confounding variables like female sex and diabetes and obesity, the study showed a strong correlation between low vitamin D levels in the blood at the time of the 6-month follow-up post-COVID-19 infection in patients who developed COVID-19 syndrome, or long COVID syndrome. So more specifically, the study showed that long COVID syndrome patients had an average vitamin D blood level of about 20 nanograms per milliliter, whereas COVID-19 survivors who did not develop long COVID had an average blood level of vitamin D that was higher at 23.2 nanograms per milliliter on average. Now, in Canada, vitamin D levels are reported in micromoles per liter, so long COVID patients in this study had an average vitamin D level of about 50 micromoles per liter, whereas the COVID-19 survivors who did not develop long COVID had an average blood level of vitamin D that was at 58 micromoles per liter. So that much of a difference can make a huge change in the risk of developing long COVID syndrome. As the researchers pointed out, vitamin D is well known to support and regulate many aspects of immune system function and help us fight off infections, including viral infections. You need vitamin D to support your immune system to ward off infections. They also say vitamin D also supports muscle health and muscle recovery, helps to improve muscle function and arthralgia symptoms like painful joints, and helps to prevent age-related muscle atrophy. Vitamin D also influences neurocognitive functions and disorders, and vitamin D supplementation has been shown to promote respiratory recovery after pneumonia in other studies. The researchers made some closing comments in their research paper, and during the Medscape interview afterwards, here are some of the quotes from the researchers themselves. One researcher said this: "In this study, we have observed that COVID-19 survivors who reported persistent signs and symptoms 6 months after hospital discharge, consistent with long COVID syndrome, were characterized by lower vitamin D levels than those without the syndrome, and lower vitamin D levels are an independent risk factor for long COVID occurrence. Another researcher said, "Our data suggests that vitamin D levels should be evaluated in COVID-19 patients after hospital discharge." So they're saying, once we release these patients, we should know what their blood vitamin D level is and get it into the optimal range to prevent long COVID from developing. Another researcher said the highly controlled nature of our study helps us better understand the role of vitamin D deficiency in long COVID and establish that there is likely a link between vitamin D deficiency and long COVID syndrome. In my view, the evidence is very convincing that for optimal immune function, it's best to have a blood vitamin D level above 75 micromoles per liter or 30 nanograms per milliliter, but no higher than 150 micromoles per liter or 60 nanograms per milliliter, unless otherwise indicated by your physician. So some patients that have autoimmune diseases, it's better for them to have higher vitamin D levels above 150 micromoles per liter or 60 nanograms per milliliter, because when you get into those higher ranges, it actually pulls back the immune system from being too overzealous. Anyway, I've provided this evidence in previous lifestyle medicine updates about ideal vitamin D blood level ranges. So I would say get your blood vitamin D level tested and take appropriate steps to get it into the ideal range. It may help to prevent severe COVID-19 infection and help guard against the development of long COVID syndrome, which can really be life-altering. So thanks for watching, and I will see you next time. I've included all the references for this, as I said, so take a look at those if you're interested. I think this is a really timely information. So thanks for watching. I'll see you next time.